added stress or an imbalance in the core muscles. So that's very important to make sure you're instructed in the proper way of doing these, but you should be able to return to normal activities.
All right, Bob, thank you for the phone call. Toll-free number 1-888-634-7488. Let's go to Delaware. Richard's on the line. Richard, what's your question for us tonight on Sports Doctor? I think we scared Richard.
Chicken Dallas.
Is he still there? That's because I was using my mad, angry voice.
He's watching the Dallas
My
game.
angry voice scares a lot of people.
Went back
Our
to
toll-free number is 1-888-634-7488. Dave, what is this thing called sciatica? What is that?
Doctor went through that a little bit earlier. Sciatica basically is an inflammation of the sciatic nerve, which is right in this area. This is the sciatic nerve that comes out of the sciatic notch. This is the sciatic nerve that comes down here, down into the buttocks, and goes down the leg. And it irritates the sciatic nerve. It could happen for several reasons. You have it tingling down the leg, down the lateral side, down into the back. Usually it stops at the knee joint. It can be caused from several reasons. A compression, trauma to the area, nerve root adhesions, piriformis syndrome, which I'll nicely explain over here, as you can see on this side, which I really brought this model for here. This is the piriformis muscle. It comes right around here. If this muscle gets tight, you can see what happens. It's compressing on the sciatic nerve.
All right. Let me get the numbers up for Cross Keys Physical Therapy. Again, we've been talking about the free screening offer. You want to take advantage of it? Call them. Make an appointment. Sicklerville, 728-1900. Woodbury, 853-0988. Washington Township, 374-3707. Pennsville, 678-8000. Vineland, 794-8300. And in Swedesboro, 467-9911. Thank you, Dr. Crome, for joining us. He's with the Rothman Institute. Sees patients in Egg Harbor Township and Voorhees, Rothman Institute. And also Dave Anselmo, physical therapist and owner of Cross Keys Physical Therapy Sports Medicine Center. Thank you for joining us, too. We'll have another edition of Sports Doctor next week. Until then, I'm Joe Chapana. Stay well.
Inner Realm Designs is a South Jersey graphic design company that is dedicated to providing high-quality design services to companies of any size. Graphic design, print design, web design. Look us up on the web at www.irdesigns.net.
Welcome to Sports Doctor. Sports Doctor is a live presentation, so we encourage you to call into the show and ask your question on injuries, training, rehab, or technique. We'll be taking your phone call shortly. Call 856-767-8884 or toll free 888-634-7488 for your direct line to Sports Doctor. Now here's your medical reporter for tonight's show, Joe Chapana.
Good evening. Thank you for joining us. It is Sports Doctor coming your way live, brought to you by Cross Keys Physical Therapy Sports Medicine Center. They have locations in Sicklerville, Woodbury, Washington Township, Pennsville, Vineland, and Swedesboro. They are offering free screenings as well, and we'll give you numbers to take advantage of that offer, because all you have to do is call and schedule an appointment. And throughout the course of the program, we'll give you the office lines for that. Right now, we want to give you our toll-free line. It's 1-888-634-7488. Tonight, we're going to be talking shoulder injuries. So if you're having problems with the shoulder, rotator cuff, what have you, our toll-free number is 1-888-634-7488. Love to hear from you about your shoulder injury problems. Answering your calls tonight, we're pleased to have Dr. Merrick Wetzler. He's an orthopedic surgeon with South Jersey Orthopedic Associates. They have locations in Washington Township and Voorhees. Next to him, Dave Anselmo, physical therapist and owner of Cross Keys Physical Therapy Sports Medicine Center. Again, our toll-free number, 1-888-634-7488. And while we wait for your calls about shoulder problems, Dave, why don't you give us the anatomy of the shoulder joint?
Sure. This is our right shoulder. First of all, we'll talk about the shoulder joint. Really has actually 4 different joints that really work together. And let's go through some of these. But first, one most known most is glenohumeral joint, which is right here. You got the sternoclavicular joint, which attaches right here in the sternum. Okay, this is the acromion clavicular joint right here, and you got the scapulothoracic joint right here. Okay, but it's the bones here is the humerus, and you got the clavicle, coracoid, and I'm actually acromion. This is the coracoid, and this is the scapula. And I will go through some of the muscles, and we'll use this model right here. You can hold this for me. Major, we're talking about the rotator cuff, subscapularis, supraspinatus, we turn around, infraspinatus, and teres minor right here. So those are the major rotator cuff muscles.
Oh, you know what, speaking about the rotator cuff, Dr. Wetzler, that always seems to be giving people problems. What is that, and why is it so important?
The rotator cuff is a set of 4 muscles. As Dave has eloquently pointed out, the subscapularis, the supraspinatus, infraspinatus, and teres minor. These 4 muscles, in conjunction with the muscles surrounding the shoulder, are what gives your shoulder such a great range of motion. They're like 17 muscles have to work in coordination so that you can lift your arm up over your head. The glenohumeral joint has the greatest range of motion of any joint in the body. With that, there has to be a little laxity in the joint to allow you doing that. There are dynamic stabilizers and static stabilizers. The static stabilizers are your ligaments in your joints. The main dynamic stabilizer is your rotator cuff. So the rotator cuff is working throughout the range of motion of your shoulder. They're fairly small muscles compared to the bigger muscles like the deltoid and the trapezius. So they can get fatigued and get exhausted fairly easily, and that would allow the other muscles to pull the shoulder in different directions, thus putting a lot of strain on the tendons of the rotator cuff, and even actually pulling it up so that the tendons pinch against the tip of this acromion right here and can result in inflammation followed by fibrosis and followed by tearing.
And Dave, what is the most common rotator cuff injury that you see?
Well, as the doctor nicely explained about it, the pinching goes around here. The most common thing is the supraspinatus tendonitis is really what we see mostly. And I think that is really because of the fact that you see a lot of people doing repetitive activities overhead, like electricians, painters, ceiling guys that put the ceiling in, Verizon guys that go up and do all the electrical stuff. And I think nowadays you're seeing a lot more of these companies downsizing and using one guy to do more things, and it's really making it tough on them, especially on the guys that do the overhead activities.
All right, Dr. Wetzler, what about the rotator cuff tear? What can be done for that?
Well, a rotator cuff tear in a working man or an active population actually should be fixed. I mean, what we need to do is actually put the tendon back into where it inserted into the humerus. And how we do that are several ways. What we can do is use a thing called suture anchors or through bone tunnels. The suture anchors actually are like screws with sutures on the end of them. We actually screw them in a bone and then tie them to the torn portion of the tendon, pulling the tendon back to where it should be. That can either be done arthroscopically or open. The advantages of doing it arthroscopically is less pain, less muscle damage, and some people say even a quicker recovery.
And Dave, when does therapy start for someone who's had this surgery, and how long does it take?
It's a great question, and I think it all starts from the surgeon. I mean, the surgeon really determines from the prescription when he wants the therapy to start. Are you ready to say something?
Yeah, if you do an open repair, we rely on, we visually tie the knots down. We know the strength of the rotator cuff. We know the strength of the sutures and so forth. Usually we'll start therapy a little bit earlier with that, within the first week or two. If we do arthroscopically, we start a little bit later, like 4 to 6 weeks. When we do arthroscopically, the damage to the muscles and the area is much less, so that we're not worried about as much scarring in the shoulder joint as we do when we do an open shoulder. If you don't start the therapy quickly with an open repair, sometimes you can develop what we call a frozen shoulder or adhesive capsulitis.
What do you do for frozen shoulder, Dave?
Well, basically, you need to stretch it out and make sure that the scar tissue, you break up that scar tissue and prevent them from that becoming adhesed. So we do a lot of stretching, a lot of joint mobilization, a little ultrasound to break up the scar tissue, because we know that's what makes up the scar tissue, the collagen, and ultrasound helps to break that up. So it's a lot of stretching and
a lot of time.
Yeah.
Think about adhesive capsulitis. It comes on slow, especially if it's idiopathic, not associated with the surgery, and I tell my patient it goes away even slower.
Okay, our toll-free number is 1-888-634-7488. We're talking shoulder injuries tonight. If you have a question for us, we'd love to hear from you tonight. Our first caller, I believe, Eric from Norristown. Eric, go right ahead with your question on Sports Doctor.
Are you talking about shoulder or knee injuries also?
I notice on our screen that we have knee as well. If you have a knee problem, Dr. Wetzler, I think we'll be happy to take the call as well. So why don't you go ahead and ask your question?
Yes, I got a question about my patella tendon. I want to know what kind of rehab I can do for that.
What's bothering you? Where's it hurting?
I had a repair, a rupture.
Okay. How long ago did you have it? How long ago?
About 3 years ago.
I mean, the thing about the patellofemoral joint has 6 different structures pulling in 4 different directions. What I think something that would be good, just a maintenance program for you, is a good stretching program, along with a strengthening program. The stretching, what you need to do is stretch your quadriceps, which is muscle in the front, as well as the hamstring. Another thing you can do is what we call mobilize your patella. Push it medially to the inside, push it to the outside, push it down towards your foot, push it up, make sure it's nice and fluid and moves nicely. The other strengthening the muscles is strengthening your quadriceps. There's a portion of the quadriceps called the vastus medialis obliquus, and that needs to be strengthened so that it helps the patella track nicely in on top of your femur, what we call the trochlear groove.
All right, Eric, thank you for the phone call. Our toll-free number, 1-888-634-7488. Dr. Wetzler, what are symptoms for the rotator cuff tear?
You see people complaining about shoulder pain. Some people think that shoulder pain is right here. Where actually shoulder pain is right here. So if you have pain on the side of your arm, on your upper arm, that goes from up here to down to your elbow, a lot of times that can be rotator cuff type pain, tendinitis, and so forth. If the pain is up here or on the medial border of your scapula, a lot of times that can be coming from your neck, either a disc or from referred pain from some arthritic joints in there.
All right, our toll-free number, 1-888-634-7488. We're talking shoulder injuries, but we'll take knee questions as well. And let's talk to Robert in Bordentown. Robert, go right ahead with your question on Sports Doctor.
Robert, are you there?
Yeah. Yeah, I have a question.
Sure.
Every time I raise my right arm, once I get past my chest, it starts to hurt, like right on the top of my shoulder. I was just wondering, what could that be from?
How old are you, Robert?
Did we get your age, Robert? We lost him.
All right, it's probably a result of tendinitis of the shoulder. When you start getting your arm up here, that's when the rotator cuff, or specifically the supraspinatus, starts to impinge on what we call the coracoacromial arch, which is made from the acromion, the coracoacromial ligament. So when you raise your arm like that, you can see that the rotator cuff tendon can be maximally pinched to that point.
What do you do for tendinitis, Dave?
Well, basically, you want to decrease inflammation. So we definitely do joint mobilization to decompress it, but we use something called phonophoresis, which is a cortisone that we rub into the area and push it in by using the ultrasound gel to push the medication in. It helps to decrease the inflammation. And obviously, a lot of stretching, and then as we get them down to decompression, then we start strengthening to stabilize the shoulder joint.
Okay, we're talking shoulder injuries, also knee injuries. Our toll-free number, 1-888-634-7488. It's Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center. Let's go to ADCO for our next caller. Is it D or Dean? D. D, go right ahead with your question, please.
I actually don't have a question. I just wanted to comment on Dr. Wetzler. He has done surgery on numerous members of my family and done an absolutely excellent job.
Oh, thank
you.
you.
He did my son's shoulder, and just right on the money.
Thank you very much.
Thank you for calling.
What was the situation with your son's shoulder?
The situation with my son's shoulder is that he had an extensive injury from sports, football and wrestling, both, and he was in an excruciating amount of pain.
Okay, always nice to hear a complimentary phone.
Always
Thanks
nice
a lot.
to hear. Nice things.
Thank you for the phone call. Our toll-free number is 1-888-634-7488. We are Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center. Ron from Tuckerton, you're on Sports Doctor. What's your question for us tonight?
Yeah, hi. About 4 or 5 years ago, I had the rotator cuff surgery on my left shoulder. It was tough. I went through all the therapy. I did what I was supposed to do, and I did heal up pretty well. But now I'm experiencing the same pain in my right shoulder. I was a bricklayer for 40 years, and I did a lot of damage laying brick. And I'm just wondering, I'm kind of ignoring it, and should I let this go? I have the pain in above my elbow, between my elbow and my shoulder, so I'm pretty sure that's what it is.
I already see Dave shaking his head now.
No, I mean, you definitely shouldn't let it go. I mean, I agree with Dave. I mean, it's something that, if it's affecting your quality of life, get it checked out. It's not something that, with time, is going to get better. It's probably only going to get worse. So you're better off getting it checked out.
Right.
It's just one of these
Why
things.
wait? Why wait to find out if it is something wrong? You can only make it getting worse. I mean, if it is something minor like an inflammation or something like that, as the doctor was explaining earlier about that impingement, if you decrease that inflammation, you're going to prevent the possibility of a tear occurring. And it could be something as simple as that. And if you ignore it and you don't wait, if you wait, it could become torn and then you have a problem. More severe. So I'd highly recommend you to get it checked out as soon as you can.
All right, Ron, take care of that now. I want to remind you we are brought to you by Cross Keys Physical Therapy Sports Medicine Center. They are offering free screenings at their offices for the next 2 weeks. To take advantage of that offer, you merely call the office nearest you. There are the numbers for their offices in Sicklerville, Woodbury, Washington Township, Pennsville, Vineland, Swedesboro, or check them out on the web at crosskeystherapy.com. It's Sports Doctor. We are talking shoulder injuries and knee injuries. We have Dr. Wetzler with us. We have Dave Anselmo, and we want to hear from you as well. Our toll-free number, 1-888-634-7488. We're taking a short break. We're playing with our models, and we'll be right back right after this.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
Some of the best athletes in the world play for the teams of Philadelphia. And when it comes to sports injuries, they put their trust in the #1 orthopedic care team in the Delaware Valley. The Rothman Institute. The best professional athletes trust Rothman. Shouldn't you?
Welcome back to Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center, Sicklerville, Woodbury, Washington Township, Pennsville, Vineland, and Swedesboro. Tonight we're taking your calls about shoulder and knee injuries. If you have a question for us, you can reach us toll-free at 1-888-634-7488. Answering your calls tonight, we're pleased to have Dr. Merrick Wetzler, who was just called yesterday and asked if he could appear on the show, and he said yes. And here he is. He is an orthopedic surgeon with South Jersey Orthopedic Associates. They're located in Washington Township and also in Voorhees. Next to him, Dave Anselmo. Dave is a physical therapist and also the owner of Cross Keys Physical Therapy. Again, our toll-free number, 1-888-634-7488. Let's talk to Kevin in Willow Grove. Kevin, go right ahead with your question on Sports Doctor.
Hi, Doctor. How are you doing? My question is, I have a problem with my left shoulder. I have like a kind of like a needle pinching feeling in the top right hand, or left hand side, and it's been that way for like 7-8 months. And I've stretched it. I've done the hot tub therapy, and I'm at a loss now. You know, I roll on it when I sleep, and it wakes me up. It really hurts. You know, it's just I got X-rays done, and there was nothing there. And now I just don't know where to go.
Okay. Difficult situation.
I mean, at this point, if it's failed treatment with therapy, anti-inflammatories, injections, I'm not sure if you had injections or not, then the next step probably logically would be get an MRI of it, see if any damage there. If still, even if MRI comes back normal and you've had the injections, you had the therapy and stuff like that, then the next step after the MRI and after all the treatment you had would be arthroscopic surgery to see what exactly is going on. An MRI is not foolproof, so doing the arthroscopic surgery would probably be the next logical step after getting an MRI.
All right, thank you for the phone call. Our toll-free number, 1-888-634-7488. George from Manahawkin, you're on Sports Doctor. What's your question for us, George?
Okay, about a year ago I fell, and as I was falling, I put my fist out, and then when I hit the ground, I knocked my shoulder out, and I couldn't move my arm, so I went to the local hospital. I don't know, could I say the hospital?
Well, that's okay. We'll just say local
I don't know whether I'm allowed to or not. In Manahawkin, all right?
Okay.
Anyway, the doctor went and sent me for x-rays, and he observed it. You know, I was in terrific pain, and he said my shoulder is out of place, and he said the shoulder, and he did it there. Then he said that'll last me about 6 weeks, 8 weeks, it'll go away. And he suggested that I go see an orthopedic, surgeon. But he says wait for about 4 or 5 weeks, which I did, and the pain didn't go away. I couldn't raise my arm.
Did you ever see the orthopedic surgeon?
What's that?
Did you ever see the orthopedic surgeon?
I saw him later on, and he looked at me and he examined me, took x-rays, and he checked my wrist, and he says I had what the hell is the word?
I mean, it sounds like a lot of times in older people, when they dislocate their shoulder, a lot of times you tear the rotator cuff as well. It's a frequent complications of a shoulder dislocation in the older population. So I suspect from listening to you, having the pain and so forth, that you tore your rotator cuff as well. And I think that an MRI is, if you haven't had one, would be probably the next step on that.
All right. Thank you for the phone call, George, and good luck with that. Our toll-free number, 1-888-634-7488. To Wilmington we go, and let's talk to Twyla. Twyla, what's your question for us tonight on Sports Doctor?
Okay. Well, over 2 years ago, I fell, and as a result, I had a broken
rotator cuff?
My collar. I had a rotator cuff repaired, and my shoulder was out of place, and as a result, I had therapy 2 times. However, as a result, I have not been able to lift my left arm. So I was wondering why is that, and I was told that it would never, do anything again.
Twyla, how old are you?
Any ideas?
How old are you?
Twyla, how old are you?
All right. Yeah, never ask a woman her age.
No, especially on TV.
On TV, yeah.
Let's assume she's 49.
It puts 10 years on your TV, even when you ask her age. Again, when you tear your rotator cuff and you repair it, it's not always as good as new. A lot of times the repair does fail, and I do suspect it probably does fail. I've had failures, I'm sure, and the best shoulder surgeons in the world have had failures. So I think she needs to be reevaluated and possibly need a revision fixation if she's having pain, if it's affecting her quality of life, and go from there.
All right, that's 2 callers who've injured their shoulder by falling. So I guess be careful. Our toll-free number is 1-888-634-7488. We need to take a short break, but first I want to tell you about our sponsor. It's Cross Keys Physical Therapy Sports Medicine Center. They're offering free evaluations for the next 2 weeks. To take advantage of the offer, call the center nearest you. There's the number in Sicklerville, Woodbury, Washington Township, Pennsville, Vineland, Swedesboro. Check them out on the web at crosskeystherapy.com. Again, we're talking knee injuries, we're talking shoulder injuries, we're taking your phone calls. Our toll-free number, 1-888-634-7488. More of Sports Doctor right after this.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
I will be.
I will be. I will be.
I will be a pro.
A professional athlete.
A gold medalist.
If you want to be a pro, then train like a pro. Hi, I'm Mike Quick, and I've joined the Velocity Sports Performance Team powered by the Rothman Institute. The highest levels of competition require more power, more speed, more agility. Here at Velocity, we train athletes of all ages and skill levels in these specific areas. Come in for a free training session and see how you can maximize your potential.
Joining us, Sports Doctor, brought to you by Cross Keys Physical Therapy, Sports Medicine Center. Our toll-free number, 1-888-634-7488. We're talking injuries of the shoulder, injuries of the knee. Joining us, Dr. Merrick Wetzler. He's an orthopedic surgeon. He is with South Jersey Orthopedic Associates, located in Washington Township and Voorhees. Next to him, Dave Anselmo, physical therapist and owner of Cross Keys Physical Therapy, Sports Medicine Center. All right, we've got Mike on the line from Cape May. Mike, go right ahead with your question on Sports Doctor.
Hi, good evening. I was playing softball back in September, and I hurt my knee. I went to my local orthopod, had an MRI. The MRI showed a severe bone contusion of the condyle of the femur. Now, this was back in September. It was checked for ligament damage, but I'm still getting a burning feeling in the middle of the knee. The ACL, PCL look good, but I still get burning feeling in the knee.
Okay.
Does it bother you when you sit down for any prolonged period of time?
No, more so when I'm walking.